Can you all hear me now?
Or
John,
yes.
you missed it. I gave you, you already know the whole speech right now was, you already know. You already know. You know, I was like, John, the man. John is amazing. John is hardworking. You already know. Lucy, you just need to sit there and continue to look pretty. Just kidding. You are amazing. No, just kidding. Just kidding. You are too pretty to be doing this. There's a lot of stuff going on. How are you all? Did you all need anything from me? I feel like I haven't checked in with CES recently, but are you all good to go? Today's just CES 101 training at some point. Just, I think, information overall about, right? If I didn't know what CES was, when I'm a partner, right? What do I need to know that'll be important? And then if I'm someone who's served, maybe I don't know how to go about, right? Because I don't have HMI's access or, who do my clients call, right? Even coming back down to, we're trying to call the home connect number, right? Get them assessed, and then, right, kind of go from there. So I think the information will be good information and I trust that you all are amazing. And I'm sorry for putting that on you, but thank you so much for doing this today. But do you all need anything from me?
No, I think we're good.
Right now. No.
All good stuff. Latasha, all good in the office?
Yep, we're good. I can hear you. We're
Okay, so I'm
recording. We're good
realizing
to
I'm
go.
having trouble hearing that. So then does that mean that if some questions, do they, it's 10 o'clock.
You guys ready?
So they would hear me when down here to the laptop. Can you all hear me now?
Yeah,
We can hear
wait,
you.
can someone speak? Tasha, are you speaking?
Yes,
Tasha, we
I'm
need to know
speaking.
which of
Can you
your
hear me?
folks are
La, la,
and
la,
say
la, la.
something.
Can you hear me now?
Tasha.
Lucy, can you hear me?
Oh, Latasha, I think I can hear you now.
Okay. Can you hear me now? Monique?
Latasha, we can hear you great now. Mark, put up the
Okay,
volume.
Okay.
Young Me says hi.
Hello.
Hi, how's everyone doing?
Good. How are you?
I'm good.
Good.
Thank you, Young Me. Very nice.
No intro.
Yes, let me check in with the team.
I just don't want to.
Mark, one second. Sorry, I was jittering.
Yeah, give me a second. Oh, that's true.
Okay, good morning, everybody. I appreciate everybody coming. Thank you. I'm gonna sit down now. I just want to get your attention. My name is Nikita Long. I am the chair. I want to welcome everybody. This is a great turnout. And so thank you, everybody, for coming. We do have just a quick minute. We've got a tight schedule, but we do have a lot of new faces. I thought it'd be great if everybody could just kind of run around, say their names, their organization. So I'll start. I'm Nikki DeLong. I am with Olive Crest.
My name is Greg Stone, the vice chair of the here today. I'm with California Family Life Center and Power Youth. Centers in the customer.
My name is Ismail Dagla. I'm the director at UCR Riverside Underground Scholars. We support incarcerated, formerly incarcerated system impact to youth adults.
I'm Joanna Harris. I'm a coordinator with the Supports of Murrieta Valley Unified. I oversee all of our mental health initiatives and I am the foster movement.
Good morning, my name is Jared Duncan and I'm a vendor here. We provide daycare for homeless parents and for the shower, breakfast and lunch.
Oh, sorry. I'm like, where are you looking? Hi, I'm Isaiah Blake. I'm one of the technical assistant providers, that was assigned to Riverside. I work at an organization called Truth on Community, and I specialize in legal.
My name's Erin. I also am a IT provider and I work at ICF.
Maria Zamores, Brandon Shearers. I am also a technical assistance provider with Angular Client. And as a user. Thank you.
My name is Sunny Lamas. I'm with the Lama Housing Project and our project is affordable development. Create more voice.
Hello, my name is O'Neill. I work with, XPX, the Family Services.
Hi.
Lisa Jones, founder and president of Silence Aloud, and this is our Bridge program.
My name is Mary King and I work here at the Bridge too. Community engagement coordinator.
Hi, my name is Teresa Ruiz. I am a social worker with Public Defender's Office, our grant funded program called SPARK. We work with TAE and also Public Defender clients 16 to 25 years. Good morning, I'm Andrea Richards. I'm with the City of Riverside.
On William Jones, City of Riverside, Department of Housing and Human Services. Daily, technically.
Hi, Sue Segura. I'm the outreach coordinator for the Riverside Anti-Human Trafficking Task Force and the Coalition Anti-Trafficking.
I'm Michelle Bernal Fierro. I'm the task force coordinator for the Riverside Sheriff's Anti-Human Trafficking Task Force and the Coalition.
I'm Marissa, yeah.
Hi, I'm Rachel Babcock with the California Family Life Center. I'm speaking out the Empower Youth Center.
Hi, good morning, everyone. My name is Maria Fernandez. I'm with Riverside County Workforce Development Division.
Hi, good morning, everyone. My name is Jocelyn Garcia Rojas with Riverside County Workforce Development.
Hi, good morning. My name is Ebony Felix and I'm a current YAG member. Hi, good morning, everyone. Hope everyone's doing well. My name is Yelmi Garcia. I'm more active in the YAG and kind of in the lead, not yet.
You said that yesterday. You are in the lead.
No, not yet, guys. So, still learning. And
My name is Caitlin.
Yeah, sure. My name is Michelle Gracia. I'm the director for Aspirant Transitional Housing for non-minor dependents, foster care, ages 18 to 21.
Hello, everyone. My name is Evelyn. I am a YAG member.
I'm Adrian and I'm with
My name is Lisa and I'm with the YAG member.
Hi, my name is Tori. I'm with the CLPC. Does anyone?
You all already know our COC,
Hi,
but,
everyone.
and then you all know me. I'm not to be cocky, I was like, I got to know me. You all work very closely together, so I'm super excited. And then if we want to go over to our partners.
So if anyone online wants to
Or
speak up
just
and do
wanna
an
go down.
introduction. Yeah.
Sure, I can. My name is John Horn with Riverside University Healthcare System Behavioral Health. I'm an admin services assistant with CES, Hope, and Home Connect.
Hi, my name. Go ahead.
It's okay. My name is Lucy Bustos. I'm also with Riverside University Health Systems. I work alongside John and I'm the CES lead.
Hi, my name is Vonia Quarles and I work with Starting Over. It's a community-based organization that provides transitional housing and reentry services in Riverside County.
Monica Baltiera, social worker with the Public Defender Spark program.
Hi, my name is Storm, pronoun she, her, hers. I'm the outreach lead and I also work at Starting Over Inc. with Vonia.
Good morning, everyone. My name is Twanisha Wilson, and I'm the one-stop operator with Equus Workforce Solutions.
That's you.
Hi, everyone. My name is Caroline Quintos. I work for Oak Grove Center. I am the housing navigator in the Thrive Independent Living Program for youth ages 16 to 21.
Hi, everyone. My name is Carolyn Travis, and I am the Community Advocacy Coordinator with California Youth Connection. We work with system-impacted youth ages 14 and 24 to transform child welfare through policy and legislation.
That's everyone?
My name is Latasha Harrell, and I'm an ASA with the COC, and I'll be doing your minutes today.
Thanks, Tasha. Is that good to go?
You
And then, Nikki, you know the change, we're gonna have Bree and our head TAs present before our CES group on the agenda. If we can take note of that change, folks. Thank you.
And then just a huge thank you and give it a round of applause for everyone for being here.
Special thank yous to our HUD for coming out. They flew out yesterday and also made time to meet with our YAB members to prepare for today. Kanisha Jones for letting us utilize her youth center. It's amazing, very welcoming for our YAB as well. And then to our COC team, who's always just up and being flexible when needed. So thank you all, COC team. All right, sorry, Nikki.
No, you're good. You're good. So yeah, this is an amazing turnout. I appreciate everybody coming, and I know some of us struggled with whatever the car accident or what was trying to get here. So the next item on the agenda is we need an approval for last month's minutes. I just need anybody who has approved those that was here to just kind of make a motion that we approve them.
I'll motion.
Okay, do we have a second? Okay, thank you. Okay.
Can I get the names of who motioned and who seconded, please?
Was it Michelle?
Michelle motioned.
Yeah.
Michelle Gracia and Sonia Lamas. I'll take that.
And we will have a time later in the day for everybody to give updates on their agencies and stuff, but at this time, we do have a moment for public comments. Was anything submitted online?
No.
No. Oh. Did anybody have any public comments at this time?
I don't mind sharing something. It's not on this agenda, so, perfect, all the comments. On April 17th, we're having a conference at UCR on reentry, on the flexible opportunities and rehabilitation that education provides and other things related to reentry for adults and youth. So you're more than welcome to register. I'll send Monica the link for registration, and then she can forward it to everybody else.
Yes, please,
Yeah.
because that's something I think a lot of us would be interested in.
Yeah, how many folks here do re-entry or justice system or justice impacted work with that subpopulation? Also folks online, if you want to put your hands up. Okay, so we have quite a lot of folks. And I just wanted to point that out as we're going through working groups later on in our YHTP. Right, that's a subpopulation that we definitely need to focus on today, right? Our goal could be to identify places where we see data for that subpopulation, also services, and then barriers, and always thinking about, right, what do we currently have, what do we need, and then how do we get there? Right, so just wanted to point that out.
Yes, because also that was something that our young adult partners mentioned as a barrier and something that they stressed as a need. So we do need to keep that forefront because that was brought to our attention from their voice. So we need to keep that key. Old business, we did send out the, well, okay, Mark, who sent out the link for the votes for our upcoming next in-person meeting. So the results were as in May, we get to go back and visit Greg. And then in August, we are going to be at Operation Safe House at their Riverside location. And then in November, we will be doing the Olive Crest location, the one in Riverside. We're not making you guys drive out to the desert. So, so I'm going to have to bake. I don't know if we can talk chocolate covered cherries, but I may make Adrian help me. I'll come over, Adrian, and we'll bake, okay? I already told Shanique I promised you cookies, so. So that is what we have, and those will be sent out reminders as we're coming up, but just so that everybody can kind of plan accordingly, that we will be having more in-person meetings or in-persons at those times and locations. New business is when we're going to switch and have the updates under the new business.
This meeting.
Yep.
Yes. Okay, cool.
Hi, so I'm just here to share with you some information about some upcoming training opportunities last time we were here, hold on, I have notes for this, I'm so proud of myself. Last time we were here, I talked about a 3-part training series that ICF, I worked with ICF to co-develop on anti-adultism and integrating youth and young adults into the work that we do and into our systems. So what does it look like to create systems that adapt to individuals rather than forcing individuals to adapt to systems? There was a lot of interest in that training series. So just to let y'all know, the first 2 of 3 are already scheduled. We're going to be using the webinar time that y'all have that's like COC wide, so it won't only be for YHTP folk, but anyone who gets the invite. So hopefully that's everyone in this room. And so we'll be starting with anti-adultism, which you've already done an awesome anti-adultism training with Isaiah. So this is just kind of a refresher in that space. And so it'll be anti-adultism and white dominant culture. And so we're getting kind of laying a framework around what are we talking about when we talk about integrating youth and young adults into this work and into this space. And so there will be some 101 stuff in this, but I really encourage everyone to attend that because it is laying the groundwork for shared definition and understanding as we move into the next two series, next 2 trainings. The second one is going to be on like authentic collaboration with the YAB. And that's really going to be talking about the impacts of trauma, how that shows up and what the impacts of perception are in our work. What does it mean when we walk into spaces carrying identities that we either completely feel at ease in our bodies about or we don't at all. And we know that other people are seeing those identities and reacting to them. So how does that have an impact? So again, a lot of this is going to be kind of the complementary trainings alongside the work that TCU does and that Isaiah has done. And then so that will be, the first one will be on March 27th. That's going to be from 10 a.m. to noon. And it will be like a Zoom link. I'm not gonna be able to come out, unfortunately, but I'm pretty solid at doing Zoom training. So hopefully it's gonna still be really, really awesome. And then the second one that we know for sure is going to be on April 24th. That will again be from 10 a.m. to 12 p.m. And then we need to schedule one for May. We haven't done that yet. So as soon as we have the date for that, we'll send it out. But again, this is using that webinar piece that the COC does monthly. So we're using that space to do this work. So hopefully it will be everyone in this room plus others from the continuum of care that are involved in work that we're walking alongside youth and adults. So just to give you kind of an overview and what to expect. And we're super stoked about that. So, and I appreciate you all being interested, like wanting to do this work. It's going to be really important for you to continue the work of YHTP with like integrity and intentionality. So I think like it's going to be awesome. Yeah. So thank you for letting me get on your agenda early. I'm going to pop out at 11, but I'll be back to have a meeting. So thank you all so much.
Okay, so then the next item on the agenda is training for CES, Coordinated Entry System. So another acronym that we're going to have to try to learn how to explain the acronyms as we use them. So if I forget, yell at me, I'm okay with that. So John and Lucy, we're going to lead the training on that, correct?
Yes, that's correct. Good morning, everybody. I'm going to go over a few things so you guys can know what CES is. And then I don't know if everybody has their laptop out. I'm also going to do some training on what needs to be done in CES to be able to connect your clients quickly to vacancies that wind up coming up. All right, so let's get started. So everybody's probably wondering what CES. CES, Coordinated Entry System, is a community-wide approach designed to coordinate and streamline access to housing services for individuals and families experiencing homelessness. It is a process that involves assessing, prioritizing, and matching people in need with appropriate housing and support resources. Individuals are evaluated based on their vulnerability and housing needs. RUHS Behavioral Health is the CES agency lead. The HOPE program has a CES division dedicated to coordinating Riverside County efforts to end homelessness in collaboration with Housing Workforce Development and the Continuum of Care. HOPE CES division staff work collaboratively with other RUHS departments and community-based organizations to provide housing resources, street outreach by city and region, and homeless service case management. Now, who's who? The team members are Home Connect is staffed with knowledgeable, resourceful, and passionate community service assistants, social service assistants, peer support specialists, and behavioral health specialists, all with one goal: to help the person on the other end of the line experiencing a housing crisis. Home Connect is only one piece of the CES pie. CES runs through collaboration of 4 passionate divisions, working closely, collectively, in an effort to improve the circumstances of our consumers and end or prevent their homelessness episode. So we have Home Connect, in-reach follow-up, street outreach follow-up, and Home Connect administration. The Home Connect call center staff are the backbone of CES. They answer incoming calls, respond to email inquiries, pre-screen consumers, and provide appropriate resources. CES follow-up is assign call center CSAs follow up with consumers identified as at risk of homelessness. In-reach teams case manage consumers identified as imminent risk of homelessness and sheltered homelessness. Street outreach teams case manage consumers identified as unsheltered homeless on the streets or in their vehicle. Home Connect administration team work hard to identify and match the most vulnerable unhoused consumers in the CES community queue to housing vacancies they are eligible for. This team works directly with housing providers, outreach and in-reach teams, and other case managers to fill available housing vacancies, ending homelessness episodes quickly and efficiently. So I am going to now jump into a little bit of training of CES and Clarity. I'm wondering, does everybody see my screen? All right, so this is Clarity. This is our coordinated entry system. First and foremost, if you're wanting to put your client into the coordinated entry system, of course, you're going to see your name right here at the top right-hand corner. You're going to click on this drop-down menu. For you guys, you will only have 2 options. You'll have your agency and then CES. I do have everything because I have access to all agencies. So you're just going to go ahead and click on the coordinated entry one and just make sure that under your name it says coordinated entry. From there, if this is a brand new client, what you're going to do is click right here where it says add client, and it will take you to a profile page pretty much where you enter in all the client data, like their social security number, first name, last name, date of birth. It is good. We did bring this up in our outreach meeting this Tuesday, that putting a nickname of the person, because some people don't know if you're going out in the street and doing outreach, they might not know their government name. They might know them by a nickname, like, but for example, what they brought up, oh, good old Red Eye. That was that person's name on the street. So a nickname would help very much if they do have one. Of course, after you fill all this out, you're going to click the save button, which would be here after you do the release of information. From there, it will take you to their actual page, which would look like this. This one was already done. This is our tester page. Due to confidentiality, and I can't put client's information and show everybody that yet. So this is a tester page. This is what it looks like when it's filled out. If this person has household members, of course, you're going to enter them in and create profiles for them also. From there, what you're going to do is now we want to enroll them in CES. So we're going to go ahead and go to the programs tab. You're going to see right where it says programs available, you'll see CES Home Connect coordinated entry. You're just going to click this little arrow. It'll drop down. And if you want to include the family members in enrolling them into CES, you're just going to go ahead and toggle each family member. From there, you're just going to go ahead and click enroll. And it's going to take you to this page, which you're going to fill out, and you will be filling out depending on the client that you're working with. It's going to ask if they're disabled, what type of residence, their current address, if they have one, or their current location, if they have insurance, Medi-Cal, Medicare, We are dealing with youth, so I doubt there's going to be Medicare. But yes, and then you're going to put who did the VI SPDAT, who wound up doing the assessment. From there, it's going to take you, after you click Save and Next, it's going to take you to a window that looks like this. And the very next thing you're going to want to do, because you did assess this client, is you're going to click the assessment tab right here on this one. And you'll see now that you can enter in your TAY age, VI SPDAT. When you click Start, exactly the way the paper form is exactly the way you're going to fill it out. It goes section by section. It is very easy, and I can show you guys what that actually looks like. So after this first part is just, rate this ethnicity and what type of assessment. Did you outreach, or was it in person? Was it over the phone? Then just like I said, in the VI SPDAT, it goes section by section, just like on the paper form. Section 1, yes or no. After you fill all of this out and finally get to the bottom, you're going to click Save. And then you will now see on the assessment, the main assessment tab, this client was scored. It will show their score. And what we do, what needs to be done for us to be able to connect your client with housing opportunities is to enter them into the community queue. This is very easy. You're just going to go ahead and click eligibility. It does take a second, and this window will pop up, but this bar will be blue and it'll say refer client directly to community queue. You will click on that, then click Save, and now your client is almost completely ready to go. The last thing we do need is documentation. So that paper form, that VI SPDAT that you do have, you're going to go to the Files tab and upload everything you have about the client. So you're going to upload the VI SPDAT. If they're rapid rehousing scoring, we only need the VI SPDAT and the homeless verification. After the client's connected, of course, they're going to want Social Security, birth certificate, maybe even income statements, depending if they have any. If this is for PSH, the only other document that we do need is going to be a disability verification or SSDI award letter. Most of our projects only cover mostly people that have severe mental illness. There are a few projects that do deal with just physical disabilities, but any verification will help out very much. Lastly, what we are trying to start utilizing is the location feature on Clarity. What you'll do is you can drop a pin, add an address on the last location that you seen the client that you're working with. This does help everybody in case somebody else comes in contact with the client, or maybe a case manager leaves. They can easily pick up to see where this client is usually located in that area. Also, if the case manager does wind up changing, usually what happens is, just like you see me on the care team, I'm not a case manager, but I did input everything. So what we are also starting to try to utilize is the note section. So if you as a case manager wind up, promoting or leaving, you can update in the notes, add the note that this person is now the new case manager. If you need to contact anybody, contact me. The old case manager has left. But as far as anything else, that is all the training I have for you guys today. Is there any questions for me?
I know.
Sorry, John, the screen's showing a little small on.
So John, I think I want partners to kind of understand, right, do we understand what we're talking about when we say HMIS or CES? How many folks here enter clients to Clarity, or your agency has access to enter clients? Raise your hand. Okay, one agency. On the call, you can also use your thing. Okay, so John, maybe the conversation is tailored, right? So folks, this is really good information to know, right? When you send a client, right, because John, this would be the process that Home Connect staff take as well. Sorry, can you all hear me? Right, John, like this is the process that Home Connect takes when they call the hotline, right? So I guess this is a good.
Correct.
Right, so like if I'm an agency and I tell my youth, right, hey, call Home Connect, at least now, right, like, does this make sense, the process that they go through with CES, right? So they need to get assessed, scored, right?
When we talk about HMIS, it's our Homeless Management Information System, which Salam is amazing. She's on our COC team and can give more info about HMIS. But this is our coordinated entry system, right? So ultimately it starts with a phone call, John?
Yes, so you're going to go ahead and call our 1-800-498-8847. You'll give them a call or have your client call that number, or they can email us at homeconnect, all one word, at ruhealth.org. And we have an after hours line if you do call the 800 number. So we do run, I believe it's 24 hours a day. We do have an on-call staff after we are closed in office to help provide resources and emergency resources after the normal business hours. So yes, if you can just have them call us, they'll do a pre-screening over the phone, see where they're at, and they'll also send an in-reach team or outreach team, depending on their location, to make contact with this client.
Thank you, John. And if you or Lucy would be so kind as to share, I know you're sharing your screen, if we can see the flyer, the Home Connect flyer for folks to look at with that number. But also, right, like, do folks have questions around if I'm serving a youth client and they need to get connected to a service, right? Like, John, what happens if I already know of a service provider and I contact that service provider and ask them if they can support, right, the youth that I'm working with, right? Then what happens then on you all's end? Like, is that the reverse referral?
Yes, so if you guys are already connected with the client, have all the documentation, and your agency has their own vacancy, you'll just submit a reverse referral. I understand a lot of people don't have access to Clarity. We are working on that, I know for sure, to get more access. At least the COC is trying to work on that. But we are here to help and support. So we normally don't every day do the data input for every agency because it would overwhelm us. And a lot of these places already have somebody that is in CES for their agency. So we do help provide some help as in data entry. We are working on going back and forth with the supervisor to see what clarification, so we can help you guys more in entering your clients into coordinated entry system if you don't have access.
The verification of homelessness, is there something we can do to help homeless youth? To help get that up and going and ready
Yes,
for you guys?
Yes, absolutely. If you can already get that documentation and all we have to do is input it, we're more than happy to do that and to work alongside with all of our partners to be able to make sure, you know, all our T's are crossed and our I's are dotted.
Yeah, I had a quick question. So just to confirm, this system is exclusive only for organizations that are directly assisting with housing insecurity, not other supportive services?
Yeah, coordinated entry is just us trying to connect clients to housing opportunities. But as far as the HOPE program, and we do everything. We have a call center, we have in-reach teams, street outreach teams, and CSA follow-ups. So we do our best to try to accommodate all other agencies and avenues to get these clients housed.
And John, you have a question in the chat from Caroline. Is this how youth can apply to Aspire housing?
Yes, I know the Aspire project is a little bit different. They are prioritizing kids that are in RCC and another school district. We are working alongside both of those to be able to fill Aspire. We are still getting clarification on what they actually need from us. Aspire has been pushed back until the end of July. To the end of August is what we heard at our last meeting last week. But we are still trying to connect all these youth to these opportunities, and we're trying to find out if we can connect youth outside of the school system to Aspire.
We have the city of Riverside, and do you all have any education Was this fire project? Just checking in. Kim, did you have any additional?
I was just gonna say in a meeting, we said that it would be August at the earliest.
August?
And that they were gonna help find other options for young people back here. And it really should, the goal is to have it for RCCD, so Moreno Valley, Argo, and Riverside students should have access.
Thank you. Sorry, folks. It looks like we're grabbing the mic so that everyone can hear. And so that folks on the call, if you all can hear us or not hear us, please let us know in the chat. Okay, thank you for that. John, did you hear Kim?
I did not hear the question. It was a little faint in the background.
Not the question. Kim had some additional info.
Okay.
Hi, John, it's Kim from Northville College.
Yes. Hi, Kim.
And I was just saying that the goal is to house as many students across the district from Riverside Community College, Northville College, and Moreno Valley College as possible. So they aren't just limiting it to RCC anymore. And then my other question, since I still have the mic, is what is going to be the process to get organizations access to CES, the system? Because it would be nice if we could enter our own people in and then we would be able to follow up and see what's happening with them rather than having to call people and contact people and, you know, hope that things are happening. We would be able to do our own follow-up.
Yes,
John,
yes.
also have some,
As far as I know, that is with HMIS. I know Gordon himself is working with city council to be able to gather more licenses. Us, even at CES, we don't have as many licenses as we should either. So yes, that it is a problem, but I know they are working on it. The ball's already rolling. I can't give a time frame on it, but I'm hoping it is very soon. They are expecting it to be soon. So if you want any more information on how to get access, you will reach out to HMIS support because CES doesn't give access.
Thank you.
No problem.
I'm part of the HMI team, so as John mentioned, we are working with our vendor as well as our contract team to get additional licenses.
So that goes on the consent. You want to hear me? Yes. All right. Let's make sure nobody get close to.
Okay.
Thanks.
Okay, no, thanks. So I was just saying that we are working with our vendor, with Focus to get additional licenses. It is taking us a little longer, but our lead is working with our vendor as well as our contracts to get additional licenses. So, and yeah, and we will let you know on the status. The licenses.
Thank you.
Anybody else have a question? Bring the mic around.
Me, again, sorry, I'm always about question. Sorry. So I want to go back to verification of homelessness. Is that just a form that we use?
Yes, and I can also send you a form that is PDF fillable that you fill out. We just need dates and location and a signature, and that can be done pretty much by anybody, even a store clerk or a person that has been homeless next to them. Yes, those all can be filled out very easily.
Okay, and then vital docs. What if they do not have the actual hard copy of their vital docs? Can they have digital copies or copies of that be, will that be eligible for them to implement?
That is a very good question. That I cannot deny or confirm. I want to say that you would have to have the actual document. I know a lot of it are scanned and it's submitted with the packet. I don't think you have to see it, but I think if it is scanned along with the application, you should be fine. But don't quote me on that because I don't fill those out.
What about potentially undocumented youth?
Undocumented youth, very good question. There are some agencies that do help undocumented youth and some that do not. I believe it's maybe 2 agencies, and I can't remember the names off the top of my head that help undocumented, not just undocumented youth, but undocumented individuals and families. But I do not remember that, and I will definitely get that information to you guys by the next meeting.
Thank you, John. Maybe if we can put together an email. And you all probably have one, right, that has like the Home Connect flyer, maybe instructions on CES, right, some of the vital documents they'll need, the verification form, and then we can also include that information in the Google Drive for folks to access. So we'll get that from you, and then you can email it to myself or COCI Youth so that we can get it out to the group. Is
Yeah,
anybody
absolutely.
online? Thank you, John. Anybody online have any more questions? Anybody have any more questions for this portion of CES? We do got quite a lot of stuff on the agenda. Go for it.
One question. Would you be able to share what other agency is working with undocumented youth?
Oh, can we get that info in the follow-up email? And I'll put in the chat all the follow-up items that we need in the email.
So what was the question again? I'm sorry.
Would you be able to share with us what other organizations are working with undocumented youth?
Yes, we can. I'll find out that information, and like Monique said, I'll give send out an email.
Thank you.
And just sure.
I don't know if this is the platform for that. Just because of mentioned Aspire Housing, that's strictly focused on unhoused and foster youth, correct? Is there
Yes,
gonna be someone that has a criminal record from living in there that's a RCCD student? Because unfortunately, formerly incarcerated people have the highest hospital rate of any population.
Yes, so I know it depends. If that's going to come from Housing Authority. I know that if they are a felon or are currently have an active charge, there is a strong possibility that they will get denied the housing. There are a few factors that are for sure that they won't, which is arson, 290s, which are sex offenders, and meth manufacturing. Those are huge disqualifications for pretty much almost every opportunity.
Why?
That is a good question. That comes from HUD.
What if the sex offender charge was as a juvenile?
That is another very good question. I will definitely find that answer out for you. But I know that for sure if the charge is on there and on their record, because sometimes you can get charges expunged. So if it's expunged and they've had it in the past and it winds up being expunged, then when they run the criminal report, they won't see it. But they will run criminal reports all the time.
DOJ background needs to be everything. Yeah.
That I have heard. I really don't work with young people and get those records so that they are able to get clear to go into housing programs. And I know Michelle, please speak to that also.
Young people too, but it's also based on the agency that wants to allow them to do that, to overlook it. It's not like, they're not legally obligated to do so. Unfortunately, it's not a protected class, so they can still discriminate and get to legally discriminate against you without any consequences.
I just want to say there is a process.
Well, I believe, I know that. I know how to help people expunge records, steal records, all the whole nine, but it's still, unfortunately, will still show up.
Did you guys receive EHB vouchers?
EHB voucher?
Yeah.
No.
John, do we have EHB vouchers? Like we have some, right?
I believe we have some. I know we're working on getting more for our program right now. I'm not sure if it's already been launched, but I know we are working on that.
Well, I bring up EHB just because, but this would require also, right, collaboration with your public housing authority. And I don't know like how y'all relationship is here between the COC and Page 8. But, the EHB vouchers are one of the lowest barrier options that have come out of HUD in like ever, frankly. So in terms of criminal background or any type of background like that, the only barrier to access with that voucher is if you have been, if you have a charge of it's very specific. It's if you have a charge of cooking meth on a PHA property, you cannot get that voucher, but otherwise.
PHA.
Yeah, Public Housing Authority, so that's like Section 8 or whatever.
Yeah.
Yeah. So if you have those vouchers that have been given to you, I don't know how many would have been given, but if you have them, I would encourage y'all to look into being like allocating a number of them for youth, because that would help alleviate some of the barrier from criminal background. But I know it's a limited resource, but a place to start potentially.
Any more questions for John? Our CES system? Nothing in the chat? Thank you. We're going to move on here. Next line of business we have is a conflict on schedules for our reentry system that's coming up here at our next meeting would normally be on the 28th. We're put a motion, recommended motion before the group to move our meeting date to March 27th instead of the 28th, because there was an all-day reentry conference. And if anybody's ever sent to attend that, it's eye-opening. There's a lot to learn. So the conference is very important to the members of this group. So we're going to see if we can get a motion to move our next meeting date to March 27th.
And then Greg.
Yeah.
So starting over is on the call. If we would allow them a few minutes to talk about the conference.
Sure.
And then if folks want to vote after, to also make sure that it aligns with our YAC and our youth population, right, that we've been trying to engage with reentry. Bonia or your team, are you all on? Oh, yeah. If you all want to take some space to talk about the conference or the summit, please.
Sure. We have a presentation. It's a short presentation if you'd like us to share that, or we can just talk about the conference and answer any questions you might have.
Or, yeah, if you want to talk about it, and then if you share the PowerPoint with Maura, we can add it to the Google Drive, and we'll drop the Google Drive in the chat for folks, so you can access all the information.
Okay.
Yeah, feel free to share your screen.
I couldn't hear what you said.
Oh, I'm sorry. I said feel free to share your screen if you'd like.
Oh, okay, cool. Let's see. Okay, am I sharing now?
Yes.
Okay, so I can't see you. So my name is Vonia and Storm is on. She and I are colleagues. We work for Starting Over, and Starting Over operates in Riverside County. Let's see how I can move this.
I believe Sophia's on too. She's going to talk a little bit about peer support.
Awesome. Oh, I didn't know Sophia was on too. Okay. So we work in the reentry space. Most of us are system impacted ourselves, which means we've been incarcerated. And when we first started, we just wanted to provide housing for people. We figured, hey, give somebody a bed and the whole problem goes away. And then we found out that there were a lot of areas in which people who had been system impacted were excluded from the things that most of us take for granted: housing, employment, licensing, family reunification. Those things began to repeat themselves in our work. And so this is our mission statement, our vision, and our values. And our mission is that we're led by formerly incarcerated people, and we aim to eradicate poverty and incarceration, and in their places create communities of care that support self-determination and that keep families safe. It is our belief that we keep ourselves safe, and it's in our remit to do that. Our vision is a world that's built on empathy and equity, where the humanity of all people is always put first and never forgotten. And I don't want to just read words, so anytime you want to interrupt or have a question, feel free to ask it. Here is the AI definition of what reentry is. It's a process of reintegrating individuals who have been incarcerated reintegrating them back into society. We know that our work is more than just reducing recidivism. Reducing recidivism is one factor, but what good is it to reduce recidivism if we're stepping over our people on the streets because they're unhoused or they can't get a job or they have mental health issues that haven't been addressed? So recidivism is but one variable. We believe in the whole person and helping them to find their best selves. So here's some data on Riverside County and nationally in terms of how many people are incarcerated and how many people are coming home. So a lot of people go to jail and go to prison. Riverside County is probably number 4 in terms of how many people we incarcerate, how many people from here are incarcerated. But 98% of those folks are coming home. And reentry is how we receive them or what we do when they come home. And so these are federal stats and it's broken out by gender because these are not counted numbers yet. These are projections that are based on the 2019 numbers, but this is a federal or national number of people. And so nationally, 443,000 people will be released from federal prisons. From local jails, we're going to see 7.25 million people released. In our county, we're going to see about 50,000 people a year coming from being released from the jail and the prisons. And that's a lot of people. Almost 50% of the people that are incarcerated have mental health issues. And most of them, when they come home, they don't have access to mental health services. So that's another challenge that we see, is how they fare while they're in jail or why they are in jail and what happens when they come home. So this is what we do, and this is our beautiful team. So we provide housing. We have a total of 12 what we call transitional housing. We do both the sober living model and the harm reduction model. We have a family reunification program helping primarily mothers who have children who are in the CPS system, helping them to navigate that system and support them through the process. We have an employment readiness program and a staffing program called Path to Seed. There's also an entrepreneur component because not everybody is going to work for someone. Some of the people coming home are entrepreneurs waiting to get the opportunity to put it into motion. And so we help support that. We do policy and advocacy work. So we've worked on changing some of the systems that we see around us. We do that. We have the All of Us or None chapter, which is a group of formerly incarcerated people who do a lot of advocacy and policy work related to their experiences with reentry. We also provide legal services through our Marshall Legal Clinic. And then we outreach in all the beautiful spaces. And so Storm is the supervisor of the outreach team. And Storm, you want to talk about your team?
Yeah, so the outreach team, we support with a lot of folks who are unhoused and currently coming home. We do in-reach also inside of CRC currently to provide reentry support, just to reentry, more like preparation and anger management for folks that are going to be coming home. We also support folks with navigating a lot of the systems that sometimes are hard to navigate when you're unhoused and freshly coming home. So that's some of the stuff that we do here within our outreach team.
Okay. We all Starting Over also provides peer support and case management services to folks who are in our housing program or we've come in contact through our outreach. And so Sophia is on and can speak to kind of like the peer support work that she does and the collaboration she does both with case managers and our other programs.
So peer support is basically additional support to the case management. So case managers focus more on goals, and as a peer support, I focus on providing additional support. So if they need a safe space to vent, someone to relate to their life experiences, to give them that additional support, that comfort, that safe space. I want them to feel comfortable in telling me about the good and the bad, and knowing that there's someone there to walk alongside them. So yeah, that's a big part of peer support, is making sure that those individuals feel supported in every way possible.
Thank you. So here's a few success stories. These are a few of the policies and laws that we've worked on during the last 5-10 years. And we believe through collaborations with partners like you all and the work that you're doing, your energy in this space was so contagious. I just want to say that. Seeing all the synergy in there and people sharing ideas, we believe that that's how we make a better world and a better society. And so this is kind of like some of the ways that you can get involved with our work. And though your specific target population might not be the same as ours, there are so many intersections and overlaps that help us to convey to the community that there is no such thing as othering, and that we all belong. And that's really that in a nutshell, that's really one of our goals. And so getting to the ask. So on March the 28th, we're having a 2024 reentry conference, and we're bringing out what we call experts, people with lived experiences who have been inside, who have come outside and had to go through the reentry process. We're bringing together the Continuum of Care and their partners. So community-based organizations who are currently doing reentry work, who might not be calling it reentry work. But anytime you look at anyone who's unhoused, about 70% to 80%, I've heard stats as high as 80% of them have had some kind of involvement with the justice system. And so reentry takes into consideration the barriers that they will face and works with them where they're at, meeting them where they're at to help them to overcome it. And so we want to have this reentry conference for a couple of reasons. One is to build partners and partnerships with more organizations that are serving this population. We wanted to come here with you all because you all have a youth lens that's missing from the reentry spaces that we've been in, and we want to bridge that and learn from you all. So we would really appreciate you all being in the space and looking for ways that we can call on our community to really make some investments in reentry and what that looks like for our community members that are coming home. There is the QR code. That's the link. If you want to come, the conference starts at 8 in the morning. Kim Saratara, the director of the Public Health Department, is going to be the keynote speaker. And then following the keynote, we'll go into panels, breakout sessions, and I think we're going to walk away with a clearer idea of what reentry is, an assessment of where we are as a county in terms of addressing the needs. Any questions? Storm, Sophia, you all want to add anything?
Oh. Yeah, I just wanted to add, I know my speech was a little bit short about outreach. We do a plethora of things here in outreach, but I did also want to add that if folks were interested in tabling, they can also reach out to me directly, and I'll put my email in the chat as well as the phone number.
Is there a cost for tabling, or is it free?
There's no cost.
Awesome. Okay. So the conference starts at 8, and I think it's over at 2. There'll be lots of resources, lots of good vendors, and some really great panels. And what we'd like to walk away with is some ideas about what our next steps are going to be. And we'd like your input on what those next steps will be.
Well, thank you so much. Does anyone else in the room or online have any questions? Okay, so we do have a motion, a recommended motion to move our Yak Yap meeting to the 27th from the 28th so that we don't conflict with this conference. Okay.
I have a quick question. Ree had mentioned something about March 27th too, about a training. Is that something?
Yeah.
It's a couple of hours difference in
Oh,
time,
okay.
so we should be able to keep with the schedule from our TAs.
Okay.
There's a couple hours difference between those two trainings.
Oh, if folks are wondering, that training's gonna be 10 to 12. And then this, we would be moving this meeting from 1 to 3.
1 to 3.
Okay.
Instead of a 10 to 12 timeframe that we normally host our meetings, that meeting on the 27th, if we move it, would be from 1 p.m. to 3.
So we could all come part of restaurant.
You show them, I'm gonna hear some folks know what that motion is and what has her hand up.
Bonnie, you have your hand up?
Yeah, I'm interested in the training on the 27th and the 24th. How do we get an invite?
We have you listed on our youth advisory committee list, and we'll be sending out the invite for that. We'll email folks that.
Because we're utilizing webinar series, right? Yeah, so Bonia, if your team or yourself have ever attended the multidisciplinary webinars, if folks do know, we are utilizing the webinar spaces to hold the trainings that we mentioned earlier. So those trainings are a part of our webinar series so that they're recorded, they're uploaded to the website and everyone has access to them. And also, right, those are the topics that we'll be covering in lieu of White Sheep and focusing on our youth population. So if you are on any of our email listservs and you receive the webinar invites, then you will receive this invite as well. And then we will send out a reminder the day before and the morning of, just to make sure that we're maximizing folks being in that space. I think it'll be really beneficial. So Bonia will make sure that your team gets that and that all of our Yak Yap members get that invite. Are you going?
So we're looking to see if we have a motion to move our next meeting date from March 28th to March 27th, from 1 to 3.
A motion.
We have a motion from Michelle. We get a second. And we get a second from Kimberly. Thank you.
How do people feel about that time frame? Does 1 to 3 work great for most folks? Raise your hand if a 1 to 3 meeting on the 27th is feasible for the Yak Yap for folks to attend. Okay.
We're gonna be busy
have to
for a
look at
couple hours in the
schedules.
morning of that day anyway, so.
Yeah. Are folks available in the morning for the webinar? Okay, we probably have to look at schedules. Cool, we'll get those calendar invites sent out as soon as possible so that folks have it on their schedules. And then for Latasha's, no purposes, okay.
Thank you. So then we're moving back to Nikki.
Oh, yeah. So, good news and bad news on my end. Bad news is the bed availability document I created got rejected with my master's project, so I just, yeah, did that for nothing. But the good news is that if I can put it live now, I'll start next month. Putting the bed availability list available for all the agencies to be able to put their stuff right out there, so the street outreach team, continuum of care can see bed availability for all the agencies that work with the additional housing program for non-minor demand. That's aging out of foster care, up of juvenile probation. As of right now, Children's First didn't, they still have quite a few. Daisy's House has 2 availabilities. Daughters of Love had 2 availability. Divinity Prophet, last I heard, was full. Downs and Martin had 3 availability. Embracing Life's Changes had 5. Kamala E only had 2. New Vision had 5. Sanctuary, out in the desert, they were full. Oak Grove Sanctuary. Olive Crest, we have 3 vacancies, all males, 1 Riverside, Moreno Valley, and out in Coachella Valley. Phoenix Rising had 7. Steps had 7. The Heart Matters did not have any, and Weldon did not report. And then Michelle, what did you have for availability?
I think Weldon said they had 25.
Oh, they didn't report to me.
Oh.
So, 'cause I wasn't- okay,
I
okay.
think they said they had 25.
Oh, did they get that new house up and going?
I think so.
Yeah.
Okay,
I think they said they had 25.
okay.
So for Spirit, we have, one parenting, female in Riverside. I have, 3 female in Riverside and 3 male in Riverside. So a total of 7.
Okay. And at this time, I definitely invite anybody that has any beds or doors available, if you would like to make that known, this is a great time. I didn't see anybody from Safe House. Do we have that?
And then just keep in mind, her list is for the 18 to 21-year-olds that are non-minor dependents in foster care, state foster care.
I don't see OSH. And then John, I don't know if there are any projects that maybe CES has that there's availability for, in terms of youth or just in any of the general programs that you can also access.
Yes, we currently only have one availability. We have 2. One is for Rancho Los Bolsas. We're no longer in need of 1 bedroom, but we still do have 6 2-bedroom and 7 3-bedroom units available, and that is in the city of Temecula. And then we also have Vista Sunrise 2, which is in Palm Springs, where we need to fill 32 units for individuals. Youth can be connected to these. They do have to be PSH scoring of 8+ and 9+ if it is a family, showing chronic homelessness and with a disability verification or SSDI award letter.
I have a quick question. So in terms of chronic homelessness, with the youth that are coming out of programs like Nikki and mine, how would there be having access to our program for 3 years or up to 6 years relate to chronic homelessness?
So John, I guess it comes back to the issue that we've identified multiple times in this space was that youth aren't meeting chronic homelessness because they're not on the streets long enough. And we've seen that the highest rate of youth experiencing homelessness are the ones leaving foster care programs at 21, right? And not having a plan for 21 and 24, right? Because of the age limit for most of the TOPs, if not all. Right. So any thoughts around that or how do they score PSH? I know you mentioned disability verifications.
Yes, so if they're coming out of foster youth, more than likely connecting them to different resources to help establish stability, like getting a job and everything like that. There is rental assistance, which is rapid rehousing, which most of these clients do fit that criteria because you don't have to be chronic. But for permanent stable housing or permanent supportive housing, which is long-term, they will need to show chronic homelessness, which is 1 year of homelessness. They could have 4 episodes in a 3-year period that equal up to 1 year. So say 1 year they're homeless for 3 months, next year they're homeless for 6 months, and then the following year they're homeless for 3 months. That does reach a definition of chronic homelessness. Those rules do come from HUD and Housing Authority. Those are what the projects are asking for. As far as any way around that, I don't know any other way around that besides showing that they are chronically homeless.
Thank you. I think there's just been that disconnect. I bring it up in every single forum that we're in with these housing programs. There's the disconnect between coordinated entry systems and the programs that the foster youth have access to. And by the time they reach 21, the older program is so limited and there's such a long wait list in many counties for the older portion. And so then that puts all of our youth that are exiting our programs at risk of being homeless on their 21st birthday. And it's unfortunate, but I get it.
It is, yeah. We do budget and stuff, but rents have gotten so stinking high that as much as we do savings matches with them and things like that, trying to rent the places.
And then for them to be really prepared at 21 is there's not a high percentage of that. They're still kind of working on their first round of education and different things. But I think that some legislative discussion needs to take place of the limitations between coordinated entry and our programs.
if you're in the extended foster care, that counts as being permanently housed. Because that is not a permanent program.
It's not a permanent program, but it doesn't count for homelessness.
Right, it
Depending
doesn't
on the
count for it.
definition. Like for DMV.
Yeah.
They're homeless. I can get them free IDs. But for this definition, they're not homeless,
Do they count as housing insecure?
depending on the program.
Yeah, I think what it is, too, Jen, is that even with, the permanent housing, some of those even have like 18 months, like the foster youth voucher is 18 months. Is that really permanent housing? That's not really permanent. Permanent would be forever, right? And I don't think there's any housing program that's forever. So I think the definition of permanent housing is kind of a little not
I'm
clear.
just wondering because you're paying a good portion of their rent.
We pay all of it.
All of it.
Not a good portion, every
So
last
then
penny.
They're not paying for their rent, and
Yeah.
if they were staying in a shelter,
Yeah.
that would count as home.
Yeah.
Right.
So I think there's some definition things that need to be fleshed out, but I get it, and I appreciate the other definition that you just brought forward, but it's just, but you know, I bring this up all the time. I never see where we fit.
But no, that's a really good point, and we're gonna be working in our working groups later for folks that are, sorry, folks that are on the call.
Yeah.
Won't be on hybrid, right, but if you do make it out in person this afternoon, we do have lunch. But yeah, I know, everyone's excited for lunch. But, right, like, we'll continue to have this conversation around PSH and what those eligible activities look like in terms of YHWP. Our head teams are with us today. They're hearing the conversation, right, and then to kind of continue when we start thinking about in the CCP, right, eligible activities, right? If we need, first we have to analyze our data, right, to see, is there a need, right? And then, I know that we have a lot of youth partners in the room, right, so checking in with our youth partners, right, like what kind of housing fitting their needs the best, right? And then based on that qualitative and our quantitative, right, taking a look at who we need PSH units for youth, and if so, what does that look like in terms of YHWP, right? Where is that flexibility, and then what would be those qualifications for youth, knowing that, right, you just have not been, right, we haven't been alive long enough to be homeless for years, but like, John mentioned, right, the inconsistency in housing counts, right? So John, if we can get any of that information, in writing that you do have available to you, I know that some of it we might have to get from Housing Authority as well. And then we do have our HUD TAs here, so we can go over, HUD regulations, HUD guidelines, and then HUD qualifications for certain programs. Again, everything is right in relation to its funding, source, right, and what those qualifications are. Right, PA, we'll kind of talk about PSH in terms of YHWP later, based on.
We did just double check real quick, so for. I don't speak loud.
Getting the steps in.
So for YHTP, and we'll talk about this a lot more as we go on, but there are special flexibilities that you can do under the YHTP funds that you can't necessarily do under regular continuing of care funds. And so for YHTP, or permanent supportive housing, they do not have to meet the chronic definition in regards to length of time homeless, but they do still have to have a documented disability. So as long as they have that documented disability, they would be eligible for PSH under YHWP.
No, that's great. So then that's when we'll kind of work with our CS team and John, right, to figure out what do those disability forms look like, right? Who's filling these out? How do I work with my client, right, to get them the proper documentation that they need, right? So we know documents and obtaining vital documents, right, are like another need and barrier that we have to kind of get that process down for all you, right? Cool. Sorry. Yeah, Madam Chair.
Oh, action. And next we go to, Monique, it's back to you for the youth action board. What is that song? I can't sing. Give me a steps in.
Sorry, yeah, I'm gonna spring this on y'all. Just because you all have been super involved, very engaged. I've seen you all on various working meetings. So I think for the YAB portion, now that we haven't established YAB, so give it up for YAB. It's amazing, right? Their time that they put in, right, not doing this work full time like some of us, right, that are in the room, right, is going to be, right, their start. If y'all want to get into social services and continue to do this work, right? But if any of our YAB members want to kind of share, like, what has YAB been doing, right? What spaces is YAB in, right? What have you been working on in YAB? What have you learned, right? What are we sharing with the community? Why are we here today? Anything like that that you'd like to share, so then people don't have to hear me all the time.
Or give an ask on who wants to speak.
And everyone can kind of just give a small section and then pass it off if you'd like, right?
Hello, everyone. So basically what we all been working for is for the mission and vision, which is the whole action thingy, which we do on Mondays and no, actually Wednesdays, and then Mondays, the whole YHDP. So we basically discuss on, one second. Need some.
And then, we're just keeping it kind of high level because we are going to do working groups later. So just high level of like, right, what is your work in YAB consisted of, right? What's your experience in YAB? What are you involved in?
So my experience has been pretty productive. So more active, I like it here. It's just more, I'm more vocal, more communicative. So, which made me level up more twice throughout the years, been involved in. So, I'm grateful to be working with everyone. So, yeah.
Hi, Ebony, and I am a, how do you say, I'm new to YAB. I joined in the month of February, so this will be my first completed month. I had the opportunity to join one of the webinars with Azaya, and it was on the social identity. And just getting to learn and communicate with how to be a better like outreach and how to understand ourselves, how to help others. And as we move forward, I would love to be involved with mission and vision. So that's a little bit about myself, but I'll be passing on.
Tori does that.
My name Adrian, the main thing that, y'all been helping me with is like, I'm pretty new as well. I came in like February. I came in like February and it was kind of rough at first. And cause like the meeting links wasn't working for me, you feel me? It wasn't working for me. And so I kept trying, you know? So I kept trying and they didn't give up. So since I'm more like, I was a little, like, I kept going meetings here and there. So I was a little confused, but since they didn't like give up and they were just still trying to help me regardless of how long it took, I was able to like get a little grasp of what was going on. And it's just really helpful because I'm able to help my homeboys. Like I'm telling them what I'm getting into. And I'm like, yo, you should get into it. And it's like, it's not like, it's cool to learn my cell type, but at the same time, it's like, I gotta give some of the homies like some type of like, they won't do it unless I'm doing it. So it's like, I'm trying to help them out.
Hello, everyone. What am I supposed to do again?
This is anything that you want to update folks about YAB. So YAB updates right in our YAB meetings are spaces for right, spaces that used to be occupied by just me, right? You all heard me kind of talking about, right? And just so that you all know as YAB members, right? A lot of the YAB updates was, hey folks, like I got a flyer together and I'm sending it out, you know, please like get your youth involved, right? Then it transitioned into, hey folks, now we have money to pay compensation. So maybe that'll get YAB members in, right? And then it was, hey, we're going to your centers to go get YAB members, right? So it's just the transition that folks have seen, right? All of our partners to really make sure that like spaces are engaged, right? And youth led, especially with YHDP. And so now being able to right, have the YAB actually engage, right, in this space. And also for YAB to feel, right, like all of our youth partners that are here, right, like we all want to feel comfortable with the community members that we work with. We want to know that folks are genuine, right, and are here for us, but also know like what is their role, right? And when they're assisting us, what does that look like? And then what feedback can we give? And where do we fit as well, right, with this lived experience of going through the system, right? And then how do we end up in positions, right? So I was a YAB member, as you all know before, and transitioning from that role of I'm a YAB member with lived experience and I want, you know, to make change and I'm not sure how to, right, being able to get an opportunity, right, with working alongside some of the amazing agencies and then now being in this capacity, right, where I can be like, okay, I was a part of YAB, so this is how we're gonna operate a YAB, right? But in that process, it's been very rough, right? Because as you all know, we've been transparent. We're all very new to the grant. We're new to this space, right? I'm new to working with youth, right? I know you would think not, but I am, right? So being able to really learn, right, from our community partners. We've done a lot of conversation around why don't the youth like me, right? Why don't the youth want to stay in our YAB group? Like, what are we missing? And so just being able to get compensation, right? And then Greg Center has been amazing at offering their support and their staff, right? Rachel has been great at really making sure that the YAB that are involved in other spaces, right, are seeing the full picture because some of you all are involved in the CYC, right, or in the youth council. And so being able to bring all of that full circle, but also bring a support network, right, to our youth partners and to YAB, right, to say, hey, we're not just in these spaces, but lean on, right, Kanisha and being able to join, right, the events that she puts on and utilizing the center, right, and then building mentorship, right? So your goal being here as YAB, right, should be to find folks that can provide that mentorship and that are willing to, right, put in that time, but also offering you that time, right, in space and all the knowledge, right, that we need to get together, right? I'm working on my professional skills as we do in YAB, and I'm working alongside you all to learn what is best for YAB. But it starts with YAB, right, making those decisions and taking, right, and feeling empowered as we're advocating for not just you all, but the youth that are going to come after you, right? And like Adrian mentioned, it's huge, right? I've always said your YAB is meant for you to come to these spaces, get the knowledge and education, get those resources, and then help the people around you, right? I know that Chantel, not to put Chantel on the spot, who's carrying the cutest baby in the world, unless you all show me other pictures of babies. So, right, like Chantel has been influential, right? She started with the YAB application that we submitted for YHDP, right? She was involved with YAB video that was created, right, to show what our need is and who the youth in our community are. Right, she's become an amazing resource to the folks around her, to the folks in her community, right? And in that bridging gaps, right? So if you need something and I cannot provide it, how do I connect you to all these amazing providers, right? And how you get yourself sustained and supported so that then you can go out and do that for everyone else. So that kind of how, thank you all, yeah, for being here, by the way, genuinely, right?
I think just acknowledging that you all showed up, just coming. That's a huge step for people in your age range, right? Just showing up and having the courage. It takes a lot of courage for you all to enter a space with a bunch of professionals. You probably have these ideas that we know how to talk well and we know what to say, and that's not really true. We don't all know how to talk well. We had to learn just like you're learning now by being around other adults to mentor us. So I just applaud you and acknowledge all of you for just showing up and having the courage to lead your peers. Right? You mentioned you're being a role model to your friends. And I caught you a few times correcting yourself. So that tells me you're already growing. You're trying to know when to speak professional speak and when it's okay to revert back, right? That's how you learn it in this space. So I applaud you all for being here.
Thank you, partners, for being here and being patient with us as well as we ask, you know, for a lot of support in this process and ask you all to create a safe space so that we can all learn in this environment together. And then if other YAB members want to go, I'm going to pass it to Zai real quick so y'all can think about your little speech. Just to give an update about what YAB is doing tomorrow.
Yes, so we will be having a YAB retreat tomorrow. So as you all heard, I specialize in youth collaboration. And so part of the purpose of this collaboration, TA, for YHDP is to build in sustainability for the YAB. A lot of time what happens in community is that YABs are formed for YHDP and then once it kind of ends, of course, the YABs kind of fall apart. And so my role is to make sure that that doesn't happen, that that keeps going. So we're gonna be working through some of the things that like the community is working through as a whole, so like the governance model, the voting structure, all of that, like kind of how the DAO governs themselves. We're gonna be talking about membership requirements, roles and responsibilities. We're gonna do some team building. I don't know like how often you all get to like be together in person. I know some of your meetings are hybrid. But part of like working on a team is like actually getting to know people that you're working with. So we're gonna do some team building. We're gonna talk about core values, mission, and vision. So some of the stuff that's happening in the community as a whole, the GAP will be doing that for their own. So I'm very much looking forward to that.
Does GAP have anything else before we?
Oh. I had to write it down. So I guess the purpose of the ad is to inform policies and create thematic changes to combat the youth homelessness and also to help. They help to reconnect and they give resources for mental health and other related issues. Also, I think last month we also discussed group agreements, you know, resolving conflicts and decision making. And also one more thing I also wrote is to I'm still working on my literature skills. Like we're not all perfect, so it's not going to happen overnight. You have to put the hard work and effort to it. So I think that it's important to like learn each other's ideas and exchange them, those thoughts, and we could discuss them. Okay. Thank you so much.
Thank you all, yeah.
Oh, it's me. Fantastic hearing all of your voices, rather than just listening to us. I like what she said. You didn't give up. We didn't give up on you. I mean, that's the way it has to happen. That's what we're here for, is to keep encouraging, keep pushing, keep caring, whatever it takes to keep these young people moving forward. That's what it's all about. We're moving into our coordinated interest system update again from Lucy.
Good morning. So I will be providing the numbers for February for the Yak Yab CS lead. So we have 64 youth on the community queue, 11 of which have been connected with opportunities and are awaiting outcome. 19 have scored a rapid rehousing score, which is a 4 to 7, and 45 have scored PSH, which is 8+. And we've added about 14 youths to the queue in total for this month.
Thank you.
Do we have any questions?
Good news. Thank you, Lucy.
No problem.
All right, we're going to move into the next category here. Our standing items is a member spotlight. The Yak member spotlight, which happens to be our own Rachel Babcock from California Federal News Center. It's been information about what we do in our organization. So Rachel, take it away.
Hey, I don't know the best way on the computers, we can't see them, but hello everyone on Zoom over there with us. Hi everyone, my name is Rachel Babcock and I am with the California Family Life Center. I've been with CFLC for a little over 14 years and been participating in multiple different programs that we have throughout the company. So today I'm kind of going to go over an overview of all of what CFLC does. I think we hear a lot about our youth centers because Greg's the coordinator for our Hemet Youth Center, and a lot of the work that we do involves our youth centers. But there's so much more that CFLC does that I think is also important to kind of highlight. So I'm going to kind of go into a brief overview, and I'll keep it a little short because I know we're all going to get close to lunch. But a brief overview about all the different programs that CFLC does have. This is our mission statement to provide safety, comfort, and healing to children suffering abuse and abandonment, to teach love and trust, to instill self-esteem, values, and hope for the future. So you can kind of finish reading through that, but, so you'll see all of our programs, provides services to youth and families. And so this is just a list of a bunch of different programs that you guys might not have known about from CFLC. My formatting kind of got a little funny, but we do have 3 SCRTP homes that are girls' homes in the Hemet area. We also have a resource family agency, so foster and adoption agency. We have a location in Hemet, and then we also have one in Indio. And then we have our Kin Care program, which is a program throughout Riverside County that supports relatives who are raising relative children. So we do like guardianship assistance with them. We do counseling and tutoring and recreation support groups, all sorts of support for the family caregivers. So like grandparents and grandchildren, siblings, aunts, uncles. And that program serves all of Riverside County as well. We also have our Safe Care program, which is a parent training program for parents who of children who are 0 to 5 who've been reported to CPS for neglect or abuse. So it's a parenting training program to kind of help keep them together. We also have a new program called Strengthening Families, and it is a 14-week family training and kind of like fun interactive workshops for parents and children 6 to 11. And they have kind of like family fun nights where they get together once a week and they do dinner and they do like fun family bonding activities. And then the parents go into do a parenting workshop, and then the youth go into do some youth workshops, help with their, resiliency and like mental health and like positive coping skills. And the parents get to learn these things too. And then they get to come back together and have, some projects or work together that they kind of help kind of build their family bond and help them all build resiliency. So it's a really great program. We have a location in Hemet, and then we also have a Spanish group in Bella Vista. And then we also have our Family Resource Network, which CFLC now partnered with. It's through First 5 and Family Resource Centers. And we're a hub for resources. So anyone in the community can reach out to our Family Resource network provider at our center, and they can provide resources. And it's kind of like, it's more than just a direct connection. She will follow up with you, she'll contact the places with you. It's kind of like a more direct support in receiving those services for resources throughout the community. And then I'll say a little bit further on our youth center. So CFLC does have 3 youth opportunity centers. We have the Hemet location, which Greg is our program coordinator for the Hemet Park Youth building. And then we have the Lake Elsinore Center, which is called Planet Youth. And then we also have our Gruvito Youth Opportunity Center, which Jeremy May is, some of you guys might have seen him at some of our COC meetings as well. So the Youth Opportunity Centers, we serve youth ages 16 to 24. And a lot of our youth are like high school dropouts. We have maybe lack of work experience, just some type of barriers to employment. So we do a lot of like pre-employment work with them. So we help prepare them for how to apply for jobs, how to build the resume, how to do cover letters, and we do mock interviews, and how to dress for success, and all of that stuff to kind of help prepare them for looking for jobs and obtaining a job. We also have a connection to education. We do certificate programs. We also do a work experience where we place them at a work site for an internship. So like usually like a 4 to 6 week paid internship where we're paying them to be at a work site to gain the work experience that we can add to their resume as well. And then especially through our Gruvito Center, we do a lot of, we have multiple programs for justice involved youth. So we are connected with like probation, there's Prop 47 that we work with both the Corona and Norco School District for a grant where we provide the work readiness for youth in YTech and also who are connected to probation through the Corona and Norco School District. And then we also have a different Salmon Law grant, which also is specifically for justice involved youth. And then we have another grant starting in July called Hire and Inspire. And that's going to again be specifically to help serve justice involved youth. To provide these pre-employment opportunities and work readiness experience for them. And then we also have our Youth Build program, which is for those who have not received their high school diploma. So they work with CBK, so they changed their name. So they work with CBK. We have a CBK at our Hemet location. So our youth will come in and they kind of go through It's to work on their education, but then they also get placed with either a construction cohort or a logistics cohort. And they get different certifications and they get the work experience while they're also working on their education through CBK. I'm always losing such CBK and Quebecans. So, and then we also have a special internship with EMWD. And Grace will tell you more information about that if you want more, but it's basically a longer term internship that these youth have an opportunity to participate in. And they're working directly with EMWD for the water treatment. And is it in Paris? Is that the location?
Multiple locations.
Yeah, okay.
I have a quick question about that water program. Is there a cap on the age for that?
Of 16 to 24-year-olds, that's through our program, which we manage through the grant with WIOA. And they also have to reside in EMWD service area, which is pretty much all of Hibbett, all of San Jacinto, all of Paris, all of Rio Valley. Not so much in Riverside, not so much in Temecula and Marietta. Because again, that's done by Hibbett Water Districts. Yeah. So the youth have to reside within the EMWD service area. If it's over that age, EMWD has their own programs that they run, especially for college students. So there's multiple pathways that they can go with.
Thank you very much.
You're welcome.
Thank you. That's why I have Gray here too. You can answer all the specifics. Okay, we can go to the next slide. This kind of goes over what I kind of already spoke about. Within our Youth Opportunity Center, the resume building, the pre-employment workshops that we do, all of the work experience opportunities. This is what we're offering through our Youth Opportunity Centers. Okay, and then we also have some other programs. My position, I'm the business resource specialist. So I do a lot of the pre-employments for the youth. So I sit directly with them and we work one-on-one to do the resume building and all of that, you know, the mock interviews, how to dress properly and everything. So I work with them on that, but I also do a lot of work with our executive director for special grants and special projects and collaborations that we have going on. So one of the newer grants that we got was a grant that we now titled My Life. So it's Living Independently, Fostering Excellence, what My Life stands for. We specifically through this grant are serving the PSS has Harmony Haven, which is in Belmont. So we specifically serve the youth from that location who come to our center every week. We have 2 workshops on Wednesdays and Fridays, and we provide them with workshops on multiple topics, but a lot of it is work readiness. We have our career cruising, we have financial literacy. We just have different presentations, life skills. We kind of ask them what they want to learn about, and we're providing those workshops to them. So that's every Wednesday and Friday from 4 to 6 that we are serving this youth population. However, we're also going to be expanding these workshops and continuing to do more through this grant, through our other youth opportunity centers in the Gulf Center and also in Rubidoux, to serve more of our general youth population and community, not just the DPSS foster youth from this location. So that's a program that we're working on expanding more of. So probably in like May is kind of when we're going to be hoping to have more workshops on a regular basis. Not that we don't do workshops, but we're trying to schedule them more on a regular basis through this funding. Another thing that CPLC does is just leadership development. We have a lot of different opportunities for our youth. Tori is part of our youth council with CFLC. She is our chair, so I was a little surprised that she didn't want to speak earlier. She's the one who helps facilitate our meetings. And so we do a lot of community service. We host different workshops. We have a leadership camp every year at Policy to Rein for our youth. We have our youth council, which is my specific group of youth leaders throughout our youth centers, and each of our youth centers has our youth council that has been reinvigorated, I should say, to provide leadership opportunities for our youth in our program so that they can be a voice for not the youth only in our youth opportunity centers, but also the youth in the community. So we've had multiple opportunities. You can hit the next slide. We've had multiple opportunities to provide some leadership for them. We've had some focus groups. We've had the Healthy Valley Foundation come out and do a focus group with our youth to try to figure out what they specifically need in their community so that they know like where they can put their resources at. So there's just been a lot of opportunities for our youth. We have a couple of different arenas where they're going to be able to be that voice, provide that insight. So we, again, like the leadership, we had a leadership and team building day on a Saturday where we came in and did a bunch of leadership and team building activities. So some of these pictures are from that event, our leadership and our team building day. We've also done several community service projects. We have a lot more coming up too that we're excited for. We've done some Valentine's Day events at Banner Care, which is a senior rehabilitation center in Hemet. And we've helped our skincare program with different recreation activities. We have a beach cleanup day that's going to be coming out. So we just have a lot of different service opportunities that we're going to be doing. And then advocacy. So every year our executive director gets to take youth with the housing workforce solutions also to DC to help advocate. So that's a trip that they do every year. And then we also have had some opportunities to take our youth to conferences with us. So we recently went to the California Workforce Association conference in Long Beach. Tori and her sister Terry were also representatives that attended the conference with us, and as part of being that youth voice and also being able to take that information back to our youth council. And then we also have another opportunity coming up on Monday where we are going to Atlanta to another youth conference for a national conference. And so Terry and Sister Tori are our representatives from our council that will be in a conference. And we're also excited to be taking Chantal with us as well to the conference to Georgia. So we're very excited for these opportunities and for the opportunities for our youth to help be actual advocates and leaders for their community. I think that's pretty much it. Yeah, so my contact information is there if anyone wants to connect with me for more information. And again, my fingers are kind of everywhere all over CFLC, so I kind of get spread out through the different programs that we have going on. The QR code takes you directly to our website if you wanted to look some more information up about our organization. And then thank goodness Greg is so responsible. He brought brochures. So I do have some brochures for our Youth Opportunity Center, our Youth Build program, and also our annual report if anyone's interested to take a look and would like some more information. And again, you can talk to myself or you can talk to Greg about any of our programs. Thank you.
If anybody have any questions, good deal, appreciate that. Yeah, Teresa.
Service opportunities, are those opportunities open for youth that need more mandated hours?
Most of our community service opportunities are going to be reserved for the youth in our program. We do open up occasionally based on the requests from the community where it happens. A lot of those get turned into on the referral from a lot of our community-based partners that are out there in the community. Because I will get the local school districts, if you all went to high school or still going to high school, or they need community service hours, just graduate. And I don't have a lot of that activity that's directly inside our center, but I can also refer them out to agencies such as Valley Community Pantry, or My City Youth, or Boxing for Christ in Tennessee, or Valley Wide Recreation, things like that, where they are looking to bring in volunteers that will help and pinch on those activities. I do get mandated requests from the courts. With all of the vetting background clearances and stuff like, because we would treat them just like they were an employee. They'd have to go through a normal, FBI, DOJ, fingerprinting, a whole 9 yards, just to be doing that with us. Always been through it. It's not something difficult, but from a cost standpoint, it's real restricted for us to open it up to the public. So if they want to come in and help, scrub the walls, clean the trash cans, that kind of stuff, I got community service hours in the center. We can find that in any one of our 3 centers doing that. But hosting or volunteering for some of the community activities that we partner with, those are definitely some good opportunities. Again, we focus a lot on
that I mentioned was specifically ones that our youth council who are already in our program. Yeah, they're already enrolled in our program that they're participating in, and they're so it's like Greg was saying, it's the service that we're providing is for those who are.
It's even one of the things that's booked into our grant, the 14 program elements that we offer through Youth Build and WIOA. That's a giving back part of the program, because we do so much with them. We make so much available for them. And then again, the expectation from our funders is to get something in return for them, and community services the easiest way. Yes.
That's why we cleaning up the beach.
We really want to go on a beach day with the youth. So we're gonna go clean up the beach. We're gonna go pick up trash and clean up, and then we're gonna have some recreation camping.
Okay, so it's gonna be like during the summer?
Yeah, we're gonna do it in the summer. I think we're.
Okay, so we could bring this to Cisco too?
So. Yeah, we're gonna work meetings.
Okay.
He just wants to have a good time.
It better not be no like, we just picking up trash, you know, go get them water.
No, we like to, put that all together. We do a little bit of work and then, you know, have a barbecue, get on a boogie boards. If that's what you want to do.
Yeah, and the thing is, like, yeah, members, not all the members are enrolled in the youth opportunity centers where we have this youth council where we're doing some of these activities. So if it's something, I'm not sure if you're enrolled or not, but if it's something that you guys are interested in, we can make sure to kind of get you guys connected to enroll into the youth center.
And even from that standpoint, we'd like to welcome, especially from this Yak and Yak group here that's present today and the ones that could be here today. If we got something that's gonna go on, we're gonna invite you. Okay, yeah. we're gonna invite you.
I just have a question.
Yeah.
For job shadowing,
Mhm.
is there opportunities to work with the medical field?
To a degree, yes.
Mhm.
We have two, I'm gonna say, you gotta call them for profit, but we have two medical offices that we work with. And it's not necessarily job shadowing. We're gonna pay you to get trained by them. Okay, one is, for our bilingual youth. The clinic of medical is nearly across the street from our center. They love bringing in young people, take them under their wing and give them that work experience part of it. Again, because they work with a lot of clients that are Spanish speaking only. And so whether or not it's doing some front office activities and even into some back office and patient activities. We also have a medical program that we make available to our youth. We've got someone that wants to get launched into medical itself. One of the entry-level positions is to become a phlebotomist. That's usually at, if you want to call it the bottom rung, that's where we start. And that's a very short program. Takes about 3 weeks to get through the certification part of it. And then you get about 100 hours that are paid of the actual internship. We have to go in and work in a clinic or work in a hospital and do your 100 blood draws. Once you've completed that, you're actually certified by the state of California to be a phlebotomist. And you can be working anywhere. No, you can sit there and say that yourself. No. As you, as a youth that's going through the training, you will actually work with patients.
And how many do you have for that?
How many spots?
Yeah, with that program.
Right now, for the one that I've been recruiting for, which has been a big challenge, we're looking for at least 15 youth. Yeah, 15 youth.
Just show your.
Chantel's hand just went right up. Yeah, it is. It is out of just him. It is out of just him for the phlebotomy.
Hey, just put an RSVP for me. I'm already got it reserved.
Do you guys have any opportunity with early childhood education?
Early childhood
Education?
education. We have a very good partnership and relationship with MSJC, who has a fantastic early childhood development program.
Yes.
They have credit and non-credit courses.
I go to Reno Valley College.
Okay.
I graduated in June,
Uh-huh.
but I wanted to enter like the internship.
I was gonna say, do you have the externship requirements you need to meet?
That's what keeps me going.
Okay, well, at our center, since we have our own foster and adoption family agency and our own kin care and all that stuff, we put our youth to work in that environment all the time, all the time. Now, if you're in the program, you would definitely be eligible to participate in something like that. If you're not in the program, we need to work on it. Yeah. But that doesn't mean that you're not someone that could come in and actually complete some externship time in that environment. Okay?
Yes, because I have most of my credit and certificate. After these two classes, because I was gonna work at the child care on campus. But then it was various some problems. But then I'm working in that right now, but I wanted to see if I can even try to get outside of the college.
Even some of our other departments, specifically like our strengthening families, we have respite care that goes on because it's very hard if you've got 5 or 6 children of your own to go into a workshop. Who's going to be looking after the ones that aren't in their own workshop, like your little toddlers over here? Who's going to be caring for them for that 1 to 2 to 3 hours when the activity is going on?
No, this my sister kid.
So we have. The cutest woman in the room. But I mean, for you to be able to participate and do that type of activity, we need to look at what it's gonna do to free up your time to. And to be able to provide that care. Again, you might just be the responsible person that's caring for your child or your sister. We look at all aspects of that to do the best we can to remove those barriers for every. Yeah. Does somebody else have a hand? Yeah, young me.
Do you also provide like the visual performing arts center or like the music industry one?
Is that something that you want to get exposed to and into? We have a music program. Okay, we have a music program. And we have an arts program. Our music program is only done through Lake Elsinore and Rubidoux. And it's really about, I mean, not just instrumental, local, it's also about the recording, the editing, the mixing, and all that kind of stuff that goes along with it at our Rubidoux. And then in the arts, Worth Visual Arts is our art director, Michelle Worth. She just completed a project. Corey knows well about that project that we just got done. And it will vary from year to year based off of what the theme is going to be. But again, it introduces you into the world of art, like that mural up there, right there. People would say that's artwork. Some people would say, yeah, it looks like a bunch of graffiti. I see a lot of messages in that. So, yeah, it depends. So, and art takes whatever form that you want it to be, but we have all those opportunities at each one of our centers for our young people. Because we all grow and learn in different ways, that's for sure.
And then I'm sure you all talked about it, but for, right, like if you're a YAP member out in the Hemet area, right, you would be connecting with Hemet CFLC, right, which would be Greg's center. And then if you're out in the Riverside area, because we know, right, access to transportation, accessibility, right, of these centers. If you're out in the Riverside area, right, you would connect to the Rubidoux YOC, which is if you picked up your check, if you were out in the Riverside and you went to the YOC center with Jeremy May, that's the center that we're talking about, right, in terms of the doesn't look the same as Greg's, right, but it is the same center. So if you are wanting to connect with any of the centers, you know, I would highly encourage you all to talk to Greg and Rachel during the lunch break to get that networking, get that started, right? Be proactive and take those initiatives. So again, don't mind me, I just came in and y'all probably already talked about it.
And there is a Moreno Valley Youth Opportunity Center also. They just are run by a different organization.
Yeah, there are 6 youth centers in Riverside County that are under contract with our partners, with Workforce Development and ED. That's who we all report to, but you have Equus Workforce Solutions, who I believe is on the call on screen right now. They have 3 centers, one in India, one in Rio Valley, and one in Paris. That does the same thing. Yeah, they move around sometimes.
And then take into account that the space that you're currently in, yeah, right? Amir. So Kanisha Jones also runs the center here, right, alongside Amir. So, right, as you're thinking about mapping out your resources, right, or what centers to get connected to. Thank you, Marm. Thank you. So as Yab is thinking about connecting to the centers, right, it is very beneficial for you to get connected, right? So in case you need resources, you need space, you need to connect with folks, right? Those are the spaces to do it in, to access services, right? Like the full circle here is, right, the youth that go to Greg Center, right? If they're in need of housing, right, resources or stability, right? It's Greg's participation in these spaces in collaboration with other partners to be able to provide those services to, right, the youth that come into the center, right? So using those centers for community partners as access centers, and then using it for youth partners and members, right, as a resource space and center, right? So you should be able to go to any of the centers and get, right, the resources that you need because they'll be well connected, right, with the folks in these spaces. And also taking into account the center that we're in, right? If Kanisha's up for it during lunch, right, for folks to see the center, or after this meeting, right, making time during lunch to go and checking out, right, the other areas of the center and also learning from Amir, right, all the great things that they're offering here in Moreno Valley as well, if this is where it's most easy for you to access, right? So again, looking for the centers that are most easy for you to access, that are close to you, right, that are in your area, that you can, right, take the bus to, and or like Greg has been very generous at, coordinating transportation for the youth that are a part of their program, right? And then also you get mentorship through that, right? I'm sure Rachel mentors a lot of youth. So, right, always finding, again, remembering that key in life, right, is having good mentors to guide you, right? And even if they're not for long periods of time, for those periods of time for what you need, right? And they're there to support you, right? And then you move to the next item. So keeping those in mind, yeah.
Any other questions?
One sec, okay. Oh, right here,
Yeah.
over there.
Next to you.
I'm sorry.
Oh, okay.
Let's still be part of the program of part of if you offer community.
Yeah, so Caitlin's asking that question about whether or not she's still gonna be serviced. Yes, you will. Okay, because you are actively in our program, even though you're going to be a city away, it's not that far. And again, we've got partnerships within the neighborhood that you're gonna be moving into. To be able to move into, for instance, let's say the next portion where you might be doing some the work experience and things like that. So one, you're a phone call away or an email away. We're still going to be able to provide the various program elements in our program to you, just because you're one city away. Now, if you moved out of the county, that would be a different story. Okay, we do need to do servicing in Riverside County. Anybody else? Good question. All right, with that, we're going to move into the next item on any agenda items for our next meeting, if anybody wanted to bring it up, or if we had any online requests. Items to discuss at our next meeting in March. March 27th. Okay, the next item on the agenda is any announcements that anybody would like to share, whether that's coming from our youth or our providers.
I'll jump in first, just in case not everybody was aware, this is more for the agencies. There is a new program being offered, it's called the Guaranteed Income Pilot Project. And it is offering guaranteed income. So this is an opportunity to submit use name and hopefully they will be selected. So the criteria, the first level is, this is for youth who they will get $750 a month for 18 months to randomly selected former foster youth applicants who will be turning 21 in the inland region. So they can be Riverside or San Bernardino County. So they have to be turning 21 between January 25th and October 25th. Or sorry, of 24. January 25th and October 25th. There is a way that you can click a link to become an approved referral source, or I am able to do that, and Michelle's already done that. So if it's going to be like jumping too many loopholes, just reach out to Michelle or I. All we need is their name, date of birth, telephone number, email address, and their permission to submit their name. There's a second side for this Guaranteed Income Pilots Project that is for pregnant youth. They must be 18 years old. They must be within the first 6 months of their pregnancy at the time that they apply. And they must reside in Riverside County. Their household income must be less than $90,616 a year. So I think. And so again, we're going to need that information. We could submit those use potentially be selected for that. So reach out if you need some info or if you need to increase.
And then Nikki, if you send that over to Mara and myself, we can put it in the Google Drive so folks can take a look at it.
Yep.
And then we'll send it to Yap as well. If you all see that you qualify and that's something that you're interested in, let me know. Not that I'll refer you, but I'll probably ask Nikki if she can help me refer you.
Yeah, there's some QR codes on the flyers that they do.
Providers can do.
And they can also call 211.
Oh, okay.
They call 211. 211 is also a partner.
Sonia, you had your hand up?
Sorry, I was gonna ask the name of the grant again, Guaranteed
Guaranteed Income
Project. But And the reason I'm saying you guys might not want to have them call 211 is because there's certain information they're gonna need to submit. Like my youth, I need to do the dependency letter, the word of court letter, the residency, there are several things. They're already reaching out to my young adults, asking for this verification information. So if they call 211, that may be hard for them to get a hold of that. So if you can link them with somebody who can help them get access to those verification.
And then the United Way is the one that's kind of spearheading the whole thing in Riverside.
Yes, Miss Hostess.
Hi, everybody. Thanks. Oh, I'm so loud. I don't really, I project very well. I might hurt your ears. So anyways, I just had a couple announcements from our side. Want to thank everybody for, using our space and, the positive feedback that we're hearing today. If you need to get in contact with me, after the event, on the front table there's, I'll paste my business card, QR code and stuff there. And then, I also wanted to just remind the youth that everything here is free to youth up to 25. So if you want to use the recording space, all of that, the QR codes are and Amir has them posted somewhere.
Right, with the computers, we see QR codes for like a lot of stuff. This would be 3 the flyers that sell just straight to our booking link for our studio time. For our studio time, for the podcasting space, for computer workstations, for anything you want to use that's in that room, you can scan that QR code and go ahead and like put that time. It's free for y'all. And then there's like flyers for our events that you can see also about the computers.
And then, also, I wanted to highlight, really excited that we just went into an MOU with the streaming podcast, streaming and radio network. And so we're going into an agreement with them to start our own radio podcast network. So on March 22nd, we're having an open casting call for youth to represent the station that'll be housed out of this location. So we're really excited about that. Amir posted the information across the computers for you guys. So we're looking for like really good talent that we can have various segments that focus on different issues. And this company has a great technology that's new, that's patented, that I think is going to help you guys monetize quicker. So we're really excited about that. I also wanted to highlight to our partners, we're having a foster youth empowerment symposium on March 14th. We do still have some some seats open for that. So the flyer is also out on the table if you'd like to attend. It's free lunch and free whatever. Free lunch and continental breakfast. We'll have a panel of foster youth, former and current foster youth that are pregnant or parenting. So that's on the 14th. Also youth during spring break. We have a lot of stuff going on here. So building your own brand workshop. We have the battle of the rap battle of the high schools locally. So that'll be here on Saturday, the 20 something, but it's you'll just follow us on IG. I don't know if you guys know who Jay Boykins is, a real popular saxophonist locally. He'll be teaching a workshop during spring break, so you guys gotta check that out too. And oh yeah, he's really good. He's really good. So we're happy to have that here too. So want to make sure you guys utilize the space. And then any community partners that are looking for a satellite site, our ultimate vision here is to be a one-stop shop, providing both behavioral health and services that address social determinants of health. So any nonprofits that want to co-locate here so that we can start building out that the one-stop shop is good. Lastly, for the youth, we have a position open. That's the same position as Amir through AmeriCorps Vista. It's a program coordinator position. I would really like to work with a youth partner for that because I was a AmeriCorps member and that's how I started my career in housing and social services. So I'm looking to offer that to position to someone else. So my contact information will be up there if you don't talk to me personally so that you can reach out to me.
Thank you. I believe we have Caroline got her hand up on the screen over here.
Hey everyone, I just wanted to mention briefly that the as many of y'all know, the SILP program and the FERS program, as well as the housing and navigation maintenance, is on the governor budget's proposed cuts. And so CYC is doing advocacy around that, and there's opportunity if any of the Yaki Yap members have experience with receiving SILP, or they are they have an FYI voucher, or they just want to help support either way. There's a coalitional letter sign-on that folks can fill out, and there's also a standing coalitional meeting that happens. One will be happening later today at 2. But I just wanted to share that, and that will also there's a potential if folks with lived experience are interested in speaking with district representatives about why it's important to preserve this housing and funding that goes directly to young people. So feel free to reach out if you have any questions, and I'll put my contact in the chat.
Thank you. Any other announcements? I would like to thank everybody for coming in today. I definitely want to thank our hosts this morning. Young Mia, I want to remind you about all the opportunities that we just talked about, especially on the entertainment.
Yeah.
Interesting? Okay,
Yeah.
I just want to make sure you copy. Yeah.
I have a question for Bree and Aaron. Are we still gonna work on the visuals?
Visuals.
For the jam board and the,
So we're gonna do a working group
that's
activities in the afternoon.
Yeah.
So we're gonna close out our youth advisory committee meeting, because I know that we are over by 5 minutes. So sorry, folks, on the call. Thank you so much for being with us.
If we can choose.
Oh, that was our video.
Let's see if we can choose.
That's a different Carol. That's a different Carol.
Hey, excuse me one second, before we stop, Monique wants to share a thing.
Yes, we're gonna, okay, are we going to go for the Yak Yak meeting?
Yep.
Are we done with the?
Yes.
Okay.